What is pharmacy? Pharmacy involves working at the forefront of healthcare and actively participating in the formulation of new treatments, prescriptions, and care management. This involves managing patient care and influencing the course of patient treatment. What does this all mean, and how does it translate in class? The truth is, it might not. As a pharmacy student, I know I spend so much of my time studying, and when I say studying, I mean memorizing. Why do I do it? Well, the hope is that one day I'll be able to be a pharmacist. I want to be able to communicate to a patient the importance of taking their medication, and I want to be part of the process of making someone better. I have decided to measure the effectiveness of the unconventional ways that pharmacy schools, Northeastern in particular, have helped students become better pharmacists by honing in on grooming communication skills. Hello, what's your name and year?
I'm Sharon Matthew, and I'm a third year.
Okay, how have you found that the curriculum has helped you with communicating better as a pharmacist?
At this point, I don't really think it's helped me that much in figuring out how to communicate with a patient, just because we've never been placed in a situation like that, nor have we seen anybody communicate with a patient, so I wouldn't really know what to do. We've learned a little bit about what a patient may have, like conditions or diseases, but I wouldn't know how to articulate that to a patient.
Okay, at this point in the program, do you feel fully equipped to handle tough patient interactions, and would you feel comfortable with dealing with clinical involvement with a patient's dosage regimen and encourage patient compliance effectively?
I don't think I would feel comfortable, just because, again, for the same reasons. I've never seen somebody do it, and I've never been placed in a situation like that. So at this point, I don't know what to talk about with a patient. As far as dosage regimens, the only practice we've had so far is doing practice problems in class, and even that is trial and error, so I wouldn't feel comfortable actually doing that for a real patient.
Okay, thank you. Fast forward 2 years, as a fifth-year pharmacy student speaks about how the changes to the curriculum have enhanced his abilities as a pharmacist. Hello. So what is your name and what year are you in pharmacy?
My name is Dayoye Owolowo, and I'm currently a fifth-year student in pharmacy.
Okay. How have you found that the curriculum has helped you with communicating better as a pharmacist?
Well, one thing about Northeastern is that they provide us with co-op opportunities to go and work. Because of my co-ops, I have been able to collaborate with pharmacists and other healthcare professionals and communicate appropriately with them. Also, I have been able to speak to patients in an appropriate manner, which has been very, very useful. That's one really good thing about Northeastern.
Okay, that's a very good point. So, other than your co-op experience, how do you think that Northeastern has helped you with communicating with patients?
Northeastern has also provided me a lot in the classroom. Example is the Pharm Care Lab that pharmacy students take in the fifth year. We've been able to interact and write different programs and different softwares for pharmacists and other doctors and other programs to ensure patient compliance and adherence to medication.
Okay. At this point in the program, do you feel comfortable with the clinical involvement with the patient's dosage regimen and encouraging patient compliance effectively?
Absolutely. This year, I've actually been taking disease management classes, in which not only talk about the conditions that a lot of our patients are going through, but also talks about the medication therapies and the dosing, and also other tips to increase patient adherence. So far, I've been adequately prepared for that.
Okay. Could you mention any distinct strategies that you believe Northeastern School of Pharmacy has used to prepare you for tough patient interactions?
Absolutely. In my Pharm Care Lab, as well as my communications lab I've taken in the past, we've been able to deal with different types of patient environments, whether it's a patient who is not compliant with medication or a patient who's not having a very good day. And we've been learning different strategies and able to not only deal with the situation, but also provide a comfortable environment for that forthgoing so that the patient will still feel respected. Some strategies we learned include Quest Scholar. Quest Scholar is a series of questions, it's an acronym for a series of questions to ask a patient so you can fully collage a situation and know how to deal with a certain situation and condition.
Okay, that's very good. Thank you.
You're welcome.
There you have it. The curriculum does make a difference. You have now seen the importance that hands-on practice has on a student's ability to handle one of the most critical components of their career, communicating. Straight from the horse's mouth, students can identify specific ways in which their curriculum has groomed them to be better able to handle tough patient interactions and be prepared in a community setting to deal with patients that have had a rough day or don't understand the importance of taking their medication and being compliant.